I'm here with Dan Buettner, author of The Blue Zones, 9 Lessons for Living Longer from the People Who've Lived the Longest. Dan, if you could, please give us a brief introduction on what a Blue Zone is, and tell us a little bit about your work, kind of teasing out the secrets of longevity.
So about 17 years ago, I got a grant from the National Institutes on Aging and an assignment from National Geographic to find the statistically longest lived pockets in the world. And it took us 2.5 years to find them. And the story and the grant was built off of the widely held assumption that only about 20% of how long you live is dictated by your genes. The other 80% or so is dictated by lifestyle and environment. So if we could find the longest lived people and find their common denominators, the idea was, in a sense, to reverse engineer longevity. So we know that these people have achieved the outcomes that we want. Now, what do they do? And that's the idea. That book you just mentioned was the topic of a cover story for National Geographic, and it became a book. So there are 9 common denominators: plant-based diet, they move naturally, they have a sense of purpose. The biggest predictors are actually their social interactions, having high quality friends and frequent and meaningful social interactions. Those are hugely predictive of longevity. But the central tenet, the most important one, is that no matter where you go and you see spry 90 and 100-year-olds, it's not because they tried. It's not because at age 50 they said, well, go darn it, I'm going to get on a fruit and vegetable diet and live another 50 years. They didn't buy a treadmill, join a gym, call an 800 number and buy a supplement. In every case, no matter where you go, Okinawa, Japan, Sardinia, Italy, Icaria, Greece, Nicoya Peninsula of Costa Rica, or right here in the United States at Loma Linda, California, it's not because people tried to live a long time. It wasn't their individual responsibility, as we often think. It's because they lived in an environment that made the healthy choice not only easy, but unavoidable. And that's what led to the 42 cities that we're working in right now to help create blue zones in America, and indeed producing higher life expectancy in all of them.
You know, I think if you asked a typical American to describe a healthy person, they might say washboard abs, they might say participates in triathlons, they might say, you know, they eat a lot of kale. They don't necessarily think of your grandmother in the garden or at a sewing circle or at church. Why is that, and how is Blue Zones sort of an antidote to sort of the typical disordered American conception of what good health looks like?
We live in a culture that celebrates youth and beauty, and that's what graces the cover of magazines, and that's who we see on TV, and we sort of get this impression. But for most of us, you know, you sort of get past 30 and you get beyond your dating years. And true health is more important. You know, actually, a hardcore triathlon and weightlifting and the things you do to get washboard abs, there's actually a pretty strong argument they're not good for you because they occasion inflammation, and chronic inflammation is at the root of every major age-related disease: Alzheimer's, cancers, diabetes, heart disease. To your question about grandma in the garden, so here's something that very few people understand. The average maximum life expectancy of human beings living in the first world is about 92. So everybody watching this right now, if you do everything right and you're an average person, if you're 98% of people out there, you can hit 92. Can't hit 100. But in America, we're hitting 79 or 80. So we're leaving about a dozen good years on the table. What Blue Zone talks about is not necessarily washboard abs, but it's a normal weight for 80 or 90 years. And those years tend to be good years. They're years free of chronic disease. And in Blue Zone's areas, the reason they're living a long time is because they're avoiding cancers, diabetes, dementia, and heart disease that is foreshortening about 80 to 85% of American lives.
Yeah, and I think what's important about your work is that it's sort of counterintuitive, I think, for a lot of people. For example, here at the Summit Daily News, we did a book club around the blue zones. And one of the things that some of the people in the group talked about was, well, all these people who live to be 100 and beyond, they eat a lot of carbs. That couldn't be right. And, I think that's what's sort of refreshing about the book is it not only does it sort of in some ways debunk fad diets or what have you, but it also underscores the idea that it's not about diet. It's not about supplements necessarily. It's not about exercise. It's just as important to focus on social relationships, which you mentioned earlier. Kind of unpack that a little bit, what you hope to accomplish by sort of preaching this Blue Zones gospel as sort of an inoculation against some of the ebbs and flows of exercise fads and diet trends.
Okay. So I try not to be too preachy. What I try to do in a very methodical, National Geographic sort of way is to aggregate the data and say within the level of scientific responsibility will allow me, this is what the world's longest lived people do on average worldwide. And I probably know that better than anybody else in the world. And I can also tell you, having done a meta-analysis, 155 dietary studies over the last 100 years in all 5 blue zones, 65 to 70% of their diet comes from carbohydrates. Now, carbohydrates have gotten a bad rap here in the United States. When we say carbs, we tend to think donuts and cookies and white rice. But actually, beans are mostly carbohydrates. Greens are very high in carbohydrates. Whole grains are very high in carbohydrates. Lollipops and lentil beans, they're both carbohydrates. I'm talking about the lentil type of complex carbohydrates. They're overwhelmingly good for us. But the bigger point, if you're unhealthy in this country, if you're overweight and like most Americans over 50 are already suffering from one of your first chronic diseases, it's probably not your fault. We live in an environment where trying to make the healthy choice is almost impossible. 97 out of 100 choices, if you go out to eat, are going to be bad for us. We spend about 3 times more times in our car every week than we did in 1970. So we've engineered a lot of the physical activity out of our lives. We think we're going to make up for sitting all day long by going to the gym for a half hour. It just doesn't work that way. What's going to work is reshaping our surroundings, reshaping our communities and our cities so that we're mindlessly nudged into doing the right thing and the wrong thing. And the healthy choice is unavoidable or more unavoidable. Excuse me.
In Summit County, we were recently ranked #1 in terms of life expectancy in the U.S. It was 86.8 was life expectancy on average here in Summit. Now, I think that's obviously a positive thing, but we've been reporting on this story for a while, and we're just in the middle of a series on longevity. And I think to all of a sudden say we're #1 in terms of life expectancy in the U.S., we've won, we're a blue zone, is misleading. I think there are big differences between the areas that you're studying in your books and even a healthy place relatively like Colorado.
Yeah, no, you're not a blue zone. So blue zone has very simple criteria. Put most simply, people have been living in that area for centuries or millennia and practicing a certain lifestyle. And what you have in Summit County is you have a selection bias. You have a number of people moving into the area who skew rich, skew more educated, and richer, more intelligent white people are going to live longer. It's just like for a while we were looking at Lac Caparo in Minnesota, which has the highest centenarian rate in the United States. And we got there and we, to use your great word, unpacked it. And we discovered, well, the reason there's so many centenarians here, concentration wise, is because the young people have all left. They moved to Minneapolis and Chicago. So that leaves an artificially high number of oldest old, and hence a higher percentage of centenarians. So, but that said, where you live in Colorado has a lot going for you. You have very good access to physical activity. There's low rates of air pollution. You have a better food environment there. You're going to have way more access to healthy fruits and vegetables than if you lived in Louisiana or Kentucky, or one of these places where there's life expectancy is about 20 years less than it is in Summit County. So, Northern Colorado, in Colorado itself, always ranks highest in America when it comes to health. So, there's something your state is doing right in general to favor longevity. I'll tell you something interesting, actually. In Sardinia, the longest lived men in the world, one of the 3 top factors we identified for favoring longevity was the pitch of the land. So the blue zone area there is about 6 villages, 40,000 people, and they live on a mountain slope. So every time they go to their friend's house, every time they go to work, every time kids go to school, it occasions a walk uphill. So you see 80, 90-year-olds walking, getting a real kind of workout several times a day by just, buying groceries or having coffee with the neighbor.
It's interesting you mentioned affluence, because I think one of the takeaways from the blue zones is none of the blue zones you mentioned in your book, as far as I can tell, are what you would characterize as an affluent area. These are not pockets of largely wealthy people. Is that correct?
That's correct. But they also don't, you're right. They would be technically under the poverty line. But what they don't have there is the American, standard American diet. So for the first time in history of the world, poverty equates with eating too many unhealthy calories, because our country is awash in cheap, unhealthy calories that marketed to poor people, and it's the easiest food for poor people to get. So if you took away junk food and the automobile, poorest people in this country would probably be the healthiest people in the world, because they'd be walking, or the healthiest people in the country at least, because they'd be walking places. They would be forced to garden. The foods that they themselves produced are going to be the cheapest and most accessible. So
I mean, it seems to me that in the U.S. and Summit County specifically, longevity, the haves and the have-nots, it sort of falls along socioeconomic lines. Is that a problem that you think a lot about as you're embarking on these public health initiatives that you're doing with towns across the country? And how do you solve that issue?
So there was a very famous epidemiologist in the 1970s. His name is Jeffrey Rose, and Rose's theorem. So public health, the way it is usually done is it identifies the tiny percent of the population most at risk, and then it aims the intervention at, let's just say, the 10% of people most likely to get heart disease, or the 10% of people most likely to get cancer or diabetes. And then public health, mostly infectious disease public health, aims at those people and spends all the money and resources. And if that intervention is 90% effective, you're still only getting 9% of the whole population. Jeffrey Rose said, instead of just the people most at risk, you unleash the intervention over the whole population, a light intervention over the whole population. So what Blue Zones does, Blue Zones project, is it unleashes a healthy swarm of nudges and defaults that's going to affect everybody, whether you're rich, poor, black, white, gay, straight, boy, male, female, it doesn't matter. And mostly what we try to do is engineer in another 20 or 30 minutes of mindless physical activity, nudging you into moving every 20 minutes, making fruits and vegetables more accessible, nudging you into better social interactions. We actually organize these MOIs. It's an Okinawan word for a committed social network. We help people find their sense of purpose and get them to volunteer. Volunteers, no matter what your demographics are, have lower BMI and lower healthcare costs. And then we try to shape policies so that roads are built not just for cars, but for humans too. If you can optimize, in our blue zone cities, you take Muscatine, Iowa, for example, where they've gone from a driving culture to one that's almost a walking culture, you can raise the physical activity level of an entire community by 30% by just making it walkable, bikeable, cleaning up parks, and make sure people can take public transportation. That's way more effective than giving everybody a free gym membership, which they'll use for a while. And after 8 or 9 months, research shows, they'll quit using it. So it's like, I don't know if you ever heard of Adam Smith, the invisible hand. We're setting up our cities so you're just, through policies, places, and individual interventions, we nudge people into slightly healthier behaviors all day long. And that intervention bakes for 5 years. And lo and behold, we get double-digit improvements in BMI, childhood obesity, smoking, single-digit improvements in life satisfaction. So people are actually reporting higher qualities of life, and they don't even know they don't even know what hit them. Right. And that's what you want to do.
So making these tweaks to sort of the human-built environment clearly is effective. But another thing that you talk about in your work is purpose, or ikigai, I think is the word you maybe use in the book. That seems to me a bit harder to engineer, maybe. And maybe talk a little bit about how important that is, because to me it seems central to the work that you're doing.
It is central. So the former director of the National Institutes on Aging authored a very famous study that retroactively looked at people's lives and their writings and found that people who could articulate their sense of purpose were living about 8 years longer than people who couldn't. So based on that, when we do a Blue Zone city project, we come in for 5 years, and we have trained people that do these purpose workshops, which are free, and we promote them. And our purpose workshop just spends an hour or two with you or anybody who's interested to take an internal inventory. And you'll be shocked at how many people just wake up, especially middle America. They wake up, they get breakfast together for their kids or themselves. They go to work, they work 8 to 10 hours, they commute back and forth to work an hour, they come home tired, they cook dinner, then they watch 4.4 hours of TV. That's the average American. These purpose workshops, for the first time in many people's lives, we take them through a process where they identify what they're good at, what they like to do, what their passions are, and an outlet for those. So you need to have an outlet. And some people find that, well, what I'm really good at is coming up with the first idea. Other people realize I'm good at getting consensus. Other people like to nurture. Other people can fix things. Other people, they're analytical. So we help them identify their gift, their passion, their strength, and then we provide a curated volunteer opportunity, and we speed date them with 5 or 6 volunteer organizations at the end of this purpose workshop, so they quickly get handed off to a volunteer opportunity. And we find that with volunteering, it stimulates the same neural pathways as crack cocaine and sugar. In other words, it's very addictive. If you get people tasting what it feels like to be altruistic, they tend to stick with it. And that's what our project tries to do. Permanent or semi-permanent changes to people's surroundings, whether it's their physical surroundings, their social surroundings, or their philanthropic surroundings.
How has your work and research changed the way you live your life?
I'm mostly vegan these days. I eat mostly a plant-based diet. like people in blue zones. I used to be a record-setting bicyclist, and I hold 3 world records. And now I sort of bike to yoga, and I know the importance of social interactions. I'm naturally kind of an outgoing guy, but now I nurture that. I actually let myself knock off in the middle of the day for lunch with a friend, or go out. I go out almost every night with people who I consider friends, or stimulate my mind, or I feel like are going to take care of me if my chips are down. I know my sense of purpose very clearly, and I live it. So I even though I don't want to be the evangelist, I don't want to be the guy follow me, but I do follow what I learned from the world's longest lived people.
How do you see the Blue Zones project evolving over time?
Well, it's been interesting because we started 9 years ago with Albert Lea, Minnesota, and it was never done before. And we unleashed this healthy swarm of 70 or 80 interventions, and you find that 40 of them fail and 40 of them are great. So you keep those 40, you add 40 more. And we've gotten pretty tight. We know our quiver of interventions is solid. The next thing we're getting really good at is training our teams and having quality control and really careful measurements. Because if you can't measure it, you can't manage it. So more rigorous measurement. And the more we prove it out, I love nothing more than to see the federal government endorse it or adopt it. At the end of the day, I love to see every community taking out a Blue Zone project. Right now, it is only the innovative early adopters, the communities that really see health and quality of life as a central value, as opposed to commerce and business interests.
Is there a particular success story you would want to highlight?
Well, it takes a while for these to work. This is not overnight work, but there's 3 communities in California. We started 6 years ago, and I'd say we're on iteration 5. They kind of joined at iteration 2, and according to Gallup, their BMI, this is a town of 125,000 people, so their collective weight is down 14%. What does that mean? That means there are 1,900 fewer obese people there than there was when we started. Smoking's down by 29%. People's well-being, it's called life satisfaction. It's a measure, self-assessment of happiness, is up about 5%. Childhood obesity is down 50%. And that, by the way, is against California control. So it's not because all of California got healthier. It's because the Blue Zone intervention. So I would point to that, and they're still on it. They're still doing Blue Zones, and I'm meeting with the executive director of what's called the Beach City Health District. They brought us in. And now we're going to do a 2.0. I just wrote a cover story for National Geographic on happiness, and found similarly that the happiest places in the world are happy because enlightened leaders made the correct policy choices 50 to 150 years ago. And now the beach cities is going to take on some of these happiness policies in addition to trying to get them healthier. Now we're trying to get them happier.
Great. Thanks for joining us. I appreciate it.
Nice to talk to you.